Hello, everyone. I'm Jimmy Patterson, and we welcome once again Father Pat Garrett, our pastor here at St. Simon and Jude's, for another Zoom interview. Father Pat's been gracious enough to join us a couple times a week to talk about things that are important to us as a parish community. And today we want to talk a little bit about where we are with regard to our safety in this time of a pandemic, and what we need to do to be prudent, but also at the same time aware of what all is going on there or out there. We have an article in this week's bulletin, in this Sunday's bulletin, Father Pat, from one of our parishioners who is an education specialist in the healthcare industry. She works with nurses. And Angie Gratz has mentioned to us in this article that if if there is any thought that the COVID-19 virus is on the wane, that's not a correct thought. It is not actually going away, at least not yet. Um, but at the same time, we've also talked about how we are at a position at St. Simon and Jude to where we're almost ready to perhaps take the next step in the reopening process. Is that right?
Yeah, so we're getting close to being able to start opening up the rooms on campus. Um, we we're still trying to get another fogger in place so that we can put in a cleaning protocol and make sure we have all of our protocol down. But I'm hoping that it'll be really soon that we can do that. Of course, at Mass, we each week the attendance keeps going up, which is a great thing, right? But we do have to continue to be concerned that yeah, this virus isn't going away. I think that's where it's so important that we each make very prudent decisions, right? We said that when we started opening up that uh, people's vulnerability to this disease varies widely, and people need to kind of take that into account and making decisions about what risks they want to take, right? It seems like the younger you are, the healthier you are, not having um, pre-existing conditions, as they call them, right? That there's not a lot of risk um, from the disease itself. Where there is risk for those who are younger is spreading the disease. Uh, but the ones that are older and the ones that have pre-existing conditions, that's where we got to be more careful. That vulnerable population, as we call it, and so we all have to make prudent decisions about that level of risk. So I want to continue to open things up and encourage those who aren't vulnerable, those who aren't at the high risk, to start coming back together in community, start certainly encouraging them to come to Mass, certainly encouraging them to come back together in ministries and small communities. But at the same time, we've got to be mindful of those that are vulnerable and continue to make sure that we take uh, extreme precautions, right? And when, particularly like at Mass, where we have mixed groups of both younger population and older population, people who are less vulnerable and older vulnerable, we've got to all make sure that we're doing what we can to minimize the spread. And that's why we insist on wearing masks in there, and that we, continue to be very cautious about the protocols and all. To be honest with you, I consider myself one of those vulnerable populations. Um, I know my immune system is taking a hit. I'm on vitamin D and all because of the MS, and I know I've had respiratory problems. I know I've had all sorts of pre-existing conditions. So I try to be a little more cautious, and I think that's where we all need to be a little more prudent about where we are, and those who are who are younger, who don't have the pre-existing conditions. I encourage them to get out there and start doing more things, but to be mindful of those of us who are maybe a little more vulnerable.
I think some part of the problem to a lot of people, myself most especially, is that it seems like it's getting better. And we go out and we see people all over the place in stores, and they're not wearing a mask and they're not taking precaution, and you hear things are getting better. So you think it's, it seems like it's getting better in some ways, but that only makes us more vulnerable.
Right. And the data is all over the place, right? It's really hard to kind of figure out what's right with the data these days, right? Everybody says we're going to make decisions based off the data. But I think what we do know about is that while the mortality rate has gotten so much better, and that's really great to see for the more vulnerable population, right? There's still some concern. I think it's great, that our hospitalizations, while they may be going up, I don't think our hospitals are anywhere near capacity. And I know here in the Woodlands, especially, right, our three big hospitals are at very low capacity still. But what I find really interesting when we started reopening, one of the things we talked about was how people would be, how people didn't have a really good sense of this disease, because at least in this area, you really never talked to anyone who even knew someone who had the disease, much less someone who had died from the disease, or had had a severe reaction to the disease. But I find now, I'm hearing a lot more people that are, one or two, three people removed from someone who has the disease, someone's brother-in-law or someone's son-in-law, or a friend of a coworker, or something like that. It is, to me, it's starting to hit home more that there are people, you just see these anecdotal signs of people in the neighborhood. Now the good news with them is, there, I haven't heard of it. I still haven't heard of anyone dying from it, right? Or that I know personally, or that I know someone who knows someone, right? And I think that's a great sign. And I think, when you hear of someone having it, it's, they very minor symptoms and things. You're not hearing of those stories that you heard early on in this. So hopefully they're getting better at the medications and things when people have it. But you are hearing more and more stories about people contracting the disease.
Yes. I have a grandson who's 2 years old and is an asthmatic. So that's when I walk 8 or 10 steps from my truck toward a store and I remember that I've forgotten my mask, I think of that, and that's what sends me back to the truck. Would you say it's helpful to people who may be resistant or hesitant to wearing masks, that they think about the people that they're helping rather than themselves?
Yeah, I think that's true. You know, and again, it also involves the environment you're in, right? You know, uh, uh, if you're in a group with a lot of healthy people, right? Then I can understand that, and I can understand. But yeah, when you're in a mixed group and all, to think about someone who is more vulnerable, even like in your case, someone who's young, right? Your 2-year-old grandson, but you wouldn't want to see him get the disease. And I think we need to, as a society, continue to think about that. I don't mean to put anybody on a guilt trip if you don't wear a mask,
Sure.
right? But at the same time, I think it's important that we do consider factors and do what we still can to minimize the spread of the disease. Mm-hmm.
Okay, Father Pat, thanks.
Yeah, I just saw an article that talked about how it is that aerial spray, right?
Right,
It's not
right.
as much contact, it's not as much the thing, but it's the talking. That's why we don't put the words up to the songs. If you want to sing along, I do. I think it's okay to sing along, but that's one of the things that we keep seeing caution about is having people singing and all because of the spray. And I certainly want to encourage you when you go around the canter or go around in that area, to be extra cautious, even for our canters, right? Some of them are are coming out, and they're a little more vulnerable and a little bit more cautious. So, do respect kind of that area and respect things. Mhm.
Okay, Father Pat, thank you for joining us. We'll see you again in a couple of days. I know we have more to talk about.
All right, good. Thank you.
Thanks, everyone.